Good afternoon, Doctor. So, Group 2 PC 401 Teamwork Skills will be presenting to you on bad teamwork skills relating to the articles we chose. So, the article we chose today is based on the surgery that leads to suicide. And we will start with the discussion with Michelle.
Hi, doctor. My name is Michelle, and basically we're talking about a case of the man undergoes surgery without anesthesia that leads to committing suicide. So basically, the root of this case is the negligence of the whole medical team, because the whole medical team did not double check the drugs before administering to the patient. They administered paralytic drug but not anesthetic drug to the patient. So basically, the patient was forced to be in anesthetic awareness situation, or so-called the lock-in syndrome, and suffered for 60 minutes before the medical team could even realize their mistakes. So basically, this event shows a lack of teamwork of the whole surgical team, be it the surgeon, the nurse, or the anesthesiologist. If ever one of the team members could even double check the procedures, the incident might not happen. So that's all from me. I will pass it on to Tong Shi.
Okay, from one point, the surgical team did not use an appropriate anesthetic before the operation, which led to the patient being consumed 60 minutes into the operation and indirectly to the patient's mental illness and suicide 2 weeks after the operation. That's point for me.
So in this case, a patient has suicided because he or she have a flashback of the incident where the medical doctors forgot to give the patient the anesthesia. So, in my opinion, I think that Lee Tongji and Michelle Ling have already explained it really well, and I also have the same opinion as them. And this, the medical doctors should have take full responsibility on checking the patient time by time, and also be more aware in this kind of situation. That's all from me. Thank you.
Okay, hello guys. So I'm from Group 2. I'm Naveen, and I'll be doing the title under the good characteristics that should be followed by a team member. So I'll be speaking up to the point that we all should have to know our role specifically, because as a team member we should have to understand our role within the team and work to achieve our duties to the best of our ability. And though you may offer help or solutions to the other team members as well, and you also should respect the boundaries of your position as well. Even we are in the highest position, in the middle, or in the lowest, we should have to respect others, and we should have to listen to others as well. So that's my point. So finally, and last but not least, as a team member, we should have to do the best for our role. Thank you.
Good evening, everyone. My name is Kyle. So the second point of like a good characteristic is being open-minded. So it doesn't matter you're a doctor or nurse or medical assistant. You should ask others' opinion and help each other. So if we do that, we can avoid situations like this, like the surgery, mistakes in surgery during surgery. That's my point. We shouldn't care about the power, the expertise of our in the field. That's my point. That's all. Thank you.
Hello, doctor. I'm Julia here. So today, my good point regarding to build up a better team is a strong leadership. According to the above passage, we can see that there is the medical negligence occur because of the poor leadership. Because when we want to do a surgery, it must be handled by an effective team and should head by a professional and skillful leader. So leadership is really important for create a good team. Successful teams typically have a leader who the rest of the team members respect and trust. These leaders unite the team members to work towards common goals by providing guidance and support. Even while facing a challenge, a strong team leader offers motivation and encouragement to keep the morale of their team members high. Excellent leaders do what necessary to help the team members complete their tasks, develop skills, and realize their potential. And good leadership also can avoid many medical negligence in the future. That's all, Dr. Thank you.
From my point for the effective characteristic, the first one is mutual respect. Actually, it's a building a culture of mutual respect that seems like a touchy-feely issue, but it is a foundational to having an effective team. If you don't give people a chance to do their job, if we complain about their backs, if we are quick to the point others' failures and so on, we are not really respecting them or being good team members. While our practice may never perfect this trait, the important thing is that we value it, strive for it, and encourage our team members to lead by modeling respectful speech and behavior. That's all from my point. Thank you.
Good evening, doctor and husband. So my point is effective communication. So the team members need to deliberate about finding system for sharing the information with one another, and they must have good communication, like talk to one another about the patient's performance and the information. So like if you want to relate with this case, if they have discussed together about before they make the surgery and about the anesthesia and all of these mistakes wouldn't have happened. So that's all from me. First, me.
Good evening, everybody, and good evening, doctor. So I'm gonna tell my point on the what are the characteristic, and I'm gonna talk about just that I feel like while the medical team did not open up on their idea of telling uh, their their idea of telling there's something wrong with the drug being proposed to the surgery, and I've been like made a mistake in not opening up on the telling by telling the drug is wrongly consult something, yeah. Then I feel like the teamwork skill in this could have been improved, and if this thing won't happen if one of the medical team did what it's supposed to, uh, and whoever involved in this could be a pharmacologist, could be the pharmacist, could be the nurse itself. Uh, if you were told to the anesthesiologist, this thing wouldn't have happened. So in this case, medical teamwork skills is really important that we seen in this case. If one of them had opened up, this thing wouldn't have happened. So that's all from me. Thank you.